All right, we are live. Okay, it's 6:04. I'm going to call this meeting to order.
Tucker Whitman.
Here.
Andy Dennison is excused. Ben Vitale.
Here.
Chris Petrus.
Present.
Paul Pickney.
Present.
Keith Bettman.
Here.
Hans Kutcher.
Here.
Charlie Ripley.
Present.
Heidi Nightingale.
Present.
Elaine Daly.
Here.
Tricia Kerr.
Here.
Timothy Lattimore.
Here.
Michael Didio.
Here.
Ryan Foley.
Present.
Aileen Mcnab Coleman.
Present. Please stand for the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing for a moment of silence. Thank you. I would like to open the public hearing, local law authorizing the purchase and service contracts to be awarded on the basis of best value pursuant to New York's general municipal law and finance law. If you would like to call into the public hearing, the number is 315-294-8051. We don't have any proclamations this evening. We're going to begin. We have two presentations on the agenda tonight. First presentation will be by Trish Kerr. She's going to give us an update on the United Way.
Right here?
Sure, that's
Okay. I'm going to give you guys an update on the work that we've been doing since March through the Cuga County COVID-19 Community Task Force. Just a refresher, this is an initiative that the legislature supported through resolution in March to establish a task force to study the impacts of COVID-19 on our community, as well as identify solutions to help reduce those impacts on our residents and our businesses. The task force has been meeting over the last 3 months. It's a 17-member group at this point that includes representatives from the private sector, public sector, nonprofit sector, individuals that represent countywide service needs. So it's a broad coalition of individuals on that group. We have been looking at data from a variety of areas, including survey, 211 data, department head reports, stakeholder interviews, focus groups, etc. Our work is ongoing. This is an interim report. Needs are constantly changing, and this is something we need to continue to monitor moving forward. What I'm reporting on today is an interim report that we are preparing, and at this point, it is in the process of stakeholder review. We're looking forward to releasing that to the public for additional comment and feedback as we move forward with recommendations in the report. Overarching themes include, and you'll see this as I talk about needs and recommendations, with COVID-19, our community is in a constant state of change. There are a lot of uncertainties and a lot of unknowns. There's a lot of temporary assistance in place right now at the state and federal level that's helping maintain some level of stability within our community. All of that is set to expire at different points in time and needs to be monitored and looked at as those assistance packages expire. and we're planning on being prepared for the impacts of those things happening. Community needs are elevated within Cuga County. It's important to remember as COVID hit that we already had a resident base that was 40% living paycheck to paycheck without a lot of assets to weather a crisis like COVID. So coming into COVID, we had some economic growth happening. There was a lot of positive things happening throughout the county, investment by business. We were on an upswing, but we also had this presence of people living paycheck to paycheck in a vulnerable state even before COVID hit. When COVID hit, we started seeing a lot of different needs across the community. Pretty much everybody has been impacted by COVID in one way or the other. The top needs that have risen out of this assessment to date, the rise in mental health and substance use disorder needs, housing, needs for children and youth, food, etc. I don't want to spend a lot of time going through needs because I want to talk about some of the recommendations and how they're going to impact the needs that we have here in Cuga County. We have also seen needs across the business community as well. Supply chain disruptions, different impacts on different service sectors. Access to capital continues to be a problem for many of our businesses. The nonprofit community has been financially impacted in a very significant way in our community, especially with the funding and the financial impacts with reductions in state aid, cancellations of fundraisers, funding delays, disruptions in fee for service, changes to state rates. Our nonprofits are being impacted in many different ways financially. And as you know, the county is also facing financial impacts in the multi-million-dollar range. So within this context of increasing financial impacts and constraints within the community across the county and nonprofit sector, within the context of rising community needs, these recommendations are being put forth for consideration. One of the things that we quickly learned from this crisis is because information is changing constantly, it's really hard to keep on top of changes to programs, hours of operation, services, et cetera. And the nonprofit community has expressed a need in recurring meetings with the county to have ongoing discussions about changes to county policies, operations, things like that. So we're looking at setting up a weekly recurring call with the county crisis response team and our nonprofit community so that needs can be talked about in real time and addressed in real time, nobody's having access to the same information at the same time. That is a recommendation that the county would need to be fully engaged in. One of the other recommendations that have been put forward is the establishment of an information exchange by the Human Services Coalition of Cuga County. This is a listserv exchange that has been in the works for a while, but because of crisis, because of the COVID crisis, the need for it is even greater to be able to track what's happening across the community, new events, volunteer needs, et cetera. So that project is getting underway and getting established, and we hope that the county can participate in that and have staff participate and join that exchange to share information. We're looking at access to services that has been significantly disrupted through COVID. I don't know if you're familiar or not with how services are presented in this community. There's a directory that's published every year. It becomes quickly outdated during COVID, and it's really been not a useful tool for residents to be able to know what changes are being made to our services. So one of the things that we've recommended is establishment of a 211 pilot project to get our services into 211, which is a national crisis hotline system that people can call to get help. We need to do that in a thoughtful way to make sure that all of the services that we have in this community get uploaded to that system. so that when somebody does need help and they call that number, they will get the information that they need. So that is another project that we are hoping to move forward. This crisis has made it clear the issues around the digital divide in this county. The assessment puts forth recommendations to expand high-speed internet access and to start taking a more serious look at that in terms of what we can do, not just with broadband, but with our libraries being a hub and community centers for people in rural areas that do not have internet access. There are some bigger picture planning recommendations coming out of this report based on elevated needs in the community that will require county buy-in. We've seen a lot of impacts on the youth in this community, disruptions to social interactions, education. One of the recommendations that has come forward is to reestablish the Youth Bureau Board. This is a board that has been relatively inactive at the county level for a couple of years now. And the opportunity to leverage funding that we do get through the state, through DSS and other sources of funding could be enhanced through a well-established and active Youth Bureau Board. So we're hoping to see that recommendation move forward. How that moves forward is a lot of details to work out, but generally speaking, that we have a Youth Bureau Board in place right now to help coordinate youth activities, assess youth needs across the county, and establish new programming that would be helpful. We are also looking at expanding the efforts that we started before COVID with our homeless. Because of this crisis, we are expecting a lot of individuals to be on the verge of homelessness or facing homelessness that have not had that experience before. So we are talking about expanding the group that we had before, adding representation from the city to really look at what we can do locally around the housing situation, as well as expand it to additional community members. We also feel it's important in workforce development to look at new short-term training programs to get people into the workforce quickly, and hope to be able to partner with the college and other BOCES, NEDA, some of the other partners that are working on workforce development. One of the things that we've talked about is because of the rising needs and the declining revenues and financial impact on the county and on the community, on the nonprofit sector, is the need to really look strategically across the community at how we do service delivery, whether or not it makes sense for the county to continue providing some of the services that it does. Is there a more cost-effective way to do that in collaboration with our nonprofit partners? Are there different ways to leverage the resources that we have through new partnerships? We're all in this tough position of having we're being significantly impacted financially, and yet we're being required to respond to higher and higher needs in this community. The need to start looking more strategically at the services that this county provides, how big our government should be, what services we should be looking at in-house. These are things that we would recommend starting to work on together with our nonprofit sector to see if there's more cost-effective ways to meet the rising needs in this community. It's a lot of information. I only had 10 minutes. I wish I had a lot longer because it's hard to push everything into a short presentation, but I'm hoping for more opportunities to talk about these recommendations in greater detail. Each of them is going to require county buy-in and further development through community input. And I just want to say that I feel like the report puts forth recommendations that are actionable they're achievable, they fit within the needs that we've identified within the community to kind of strengthen the infrastructure and the support network that we have around community needs in this county.
Any questions for Trish? Mr. Lattimore?
Trish, while you're right there, I know you and I are co-sponsoring a piece of legislation tonight, and it fits in well with this stress factor that everybody's going through. I don't know whether you want to say something about our legislation, since you got the floor right there, and
Yeah.
how cost-effective it could be in its financial stress times.
Yeah, are you talking about that AANA
Yes.
resolution? So Legislator Lattimore put forth a resolution, and I'm proud co-sponsor of that, to calling on the governor to declare substance use disorder mental health services as essential during an NA and AA support groups as essential support services during COVID. These were shut down early on during our pandemic and had a profound impact on that population. There's no cost for somebody to go in and do that. It's a highly effective peer-to-peer networking and support service that we want to see continue and not limit access to that during COVID.
Liquor
There's also-
stores are open, we want to have someplace to go for people with addictions.
Absolutely.
And we realize the death rate has gone up much higher from this overdose. I had one young gentleman on my apartment building OD'd and died. So it's close to home too.
Yes, that's definitely the case. The opioid deaths just through June of this year are the same as all of 2019. So we're seeing that play out in the numbers. And there's been significant withholdings from state aid for those services in the third quarter, with uncertainty about whether or not those funds looks like. So that is definitely and something personally I would like to see exempt those types of services from further meter.
Any for Aileen? Okay.
I guess I will just say that I'll keep you guys abreast of future opportunities to hear more about this as it continues to evolve.
Thanks, Trish. Thank you.
Thank you.
Legislator
Thank you.
Kerr. I said Otley, I'm sorry. Okay, up next, we have the Health Department here for a update on our COVID response. Yeah. And Nancy Purdy today joining us. Thank you for coming.
Good evening, everyone. It's been some time since I've had the chance to present to all of you, so I welcome that. In the interim of the last time I was here, the health department continues to be working 7 days a week on COVID-19 related activities. So I'm going to highlight just a few of them briefly, and then I'm going to ask Nancy if she'll come forward and give you a few stories, because sometimes stories are easier for you to remember so that they stick with you more than statistics at times. So contact tracing continues to consume an immense amount of time for our staff. Related to that is getting isolation case, which is a diagnosed ill individual. And you follow up with that individual not only for their well-being and are their needs being met, but who have they been in contact with during their most contagious period. And then we have to speak and spend time with each of those people. And Some people go into quarantine, some people don't, but everyone has an interview, everyone has a conversation, every situation is different. One of the newer circumstances with some of the guidance in the last few weeks has been the quarantine of people from restricted states, not just from other countries. So that certainly has increased significantly the number of people that we should communicate with. In this particular situation, we have requested New York State, along with many of our partner counties, to perform that travel follow-up on our behalf. That's supposed to be starting this week. So prior to this week, we've been doing it, but the idea is if someone comes into an airport, they must fill out a form, where they're from, where they're staying, how they can be contacted. That form goes to a State Department of Health representative right there at the airport. For people who drive in or take another form of transportation, it's on their honor. We request that they fill out information online on the state website, and then follow-up is done from there. And it doesn't mean they can't see the people they've come to visit. It means we're asking them to stay put when they come to see the people that they visit and monitor themselves for signs and symptoms. We're also continuing and have until today our specimen collection, or our drive-through clinics as they're referred to. We had just today, we had 99 people, I think 90 people showed up, but we are on pause after this moment, and certainly will reconsider and look where things are at in a few weeks, but we need to reallocate our resources toward the mandatory school-based immunizations. So our nursing staff will be picking up the requirements of providing the school-based immunizations for children, because schools are on the track for reopening. We know that's fraught with a lot of discussion and determinations yet to be made when it comes to schools, but nonetheless, children still need to be vaccinated, and we have quite a lengthy waiting list. If this is anything like last year, we know that there will be children who will not be able to participate in school if they have not received their vaccinations. So we need to get going on that. Another area where we've been spending a lot of time is in helping interpret the guidance that comes out from the New York State Department of Health. As all of you who pay attention to this know, it's constant. There's a lot of information there. It changes frequently. New information all the time as far as gatherings, as far as essential workers, as far as regulatory aspects for food service entities. I will say that I think people's respective associations certainly are trying to stay on top of this also and share information, but we have certainly had more than our share of frequent phone calls trying to provide some guidance. We do have the benefit, fortunately, of having a list of all the permitted facilities when it comes to food service, so we're able to send information out to them in advance or as soon as. A lot of times we're finding out the information at the very same time that everybody else is finding out the information. So not only are we trying to interpret it, we have to use our resources, which may be through the State Department of Health, it may be through the governor's office, to get some clarity, because nothing is more frustrating than having inconsistencies across counties, both for the business owners as well as for those of us who are tasked with enforcing it. Which brings me over to enforcement. That is an area where we had a lot of discussion at today's Board of Health meeting. We've had a lot of discussion in the past few weeks. We are moving forward with it. There will be enforcement. Where we are finding the most frequent calls and concerns are related to use of face coverings. I should say proper use of face coverings. And mass gatherings primarily. Certainly there's other situations that come to our attention. We get dozens and dozens and dozens of calls every week related to this. We get emails, we get social media requests. The health department's not the only one who gets these requests. And what we started doing a few weeks ago was asking people to call the New York Pause phone number, because that way it goes on record with the state. So So you call the 1-833 number, and I don't have it in front of me, but it's on our websites, and I can share that with all of you if you'd like. It gets recorded by whoever answers the telephone in Albany, and then it's sent down to the New York Pause entities in our county. And in our county, it's the city police and the county sheriff department. So then they are tasked with providing some sort of response to each one of those calls. What the city police chief has been doing is not only responding, but he's been sending the health department some backup. The report that his staff are doing when they do the follow-up, which has been very helpful because we've started a spreadsheet so that we can compare the concerns and complaints we're getting directly along with what they are receiving as well. And we can see what actions have been taken so that as we move forward, we'll know how many times we've had interactions. Anything we've done prior to a week ago, we may or may not have a firm record of. We have some things written down, but we know the ones that stand out. We know the ones that we get a lot of calls on. So they will be the ones that we will be addressing first. We'll continue to share our data routinely. As you know, we've been sending press releases to all of you. When they come out, we regularly schedule them Mondays and Fridays right now. We keep some graphs updated with data. We update the map a couple times a month, and other information as it becomes available and we create. I sent you all some quantitative data, but I'll be updating that information and sharing that with Aileen Mcnab Coleman as she prepares her State of the County remarks. So she'll have some up-to-date information to add to that. And before I turn this over to Nancy for a couple moments, and I might add that Nancy has been remarkable, as have all of our staff, and I always feel the need to compliment them because they are remarkable. It is the entire health department who has been working 7 days a week. And Nancy has been tasked with being our operations in-house. So she's overseeing all of our clinical care, plus, of course, operations has its hand over some other activities as well, purchasing and planning and all of those other aspects play a role in our operations. So I can't say enough great things about what Nancy has done, and I think those of you who've had the opportunity to have communications with her certainly know it, but she takes the time with every single encounter she has to explain, to teach, to educate, and it's been really positively remarked on. And it sets the tone, right? That we are all ambassadors for the work that we do, and it's really important. So that brings me to my final remark, which is to say, thank you and keep up the good work. For those of us, we need to set the example, right? For prevention, we need to wear our face covers properly. We need to keep our distance as we ought to. We need to wash our hands. We need to stay home when we're sick. Right or wrong, I think we're held to a higher standard. All of you are visible public leaders, and the expectation is that you set the example, and we appreciate that because we are looking to do the same thing. And right now, again, prevention is all we have. So that's what we're moving forward with. So Nancy, I'll invite you to come up here, but questions if you want. If you want to wait till after Nancy speaks, that's up to you guys.
Legislator Lattimore?
Kathleen, we're doing more testing for the COVID. Are we doing any testing for the antibodies?
There is antibody testing available through some healthcare providers and through one of the urgent care centers. We encourage people to talk to their healthcare providers about antibody testing so if they have some sense of the benefit or not of having an antibody test at a particular time. And right now we're still waiting to find out, based on research, based on the current science, whether antibodies are going to identify to us whether people have any sense of immunity and for how long. And there's a lot of study going on.
Okay, we're going to go with Petrus, and then Mr. Foley, then Ms. Nightingale.
Thank you, Madam Chair. First and foremost, I want to say thank you guys. I know you're burning the candle at both ends, so thank you to you guys and thank you to all your staff for the hard work that you're doing. But and perhaps I'm overreacting, but in your presentation, I heard enforcement.
Mm-hmm.
So I guess maybe you or the county attorney can explain what the prescribed punishment is and possibly the code or the law or the statute which prescribes for the ability to enforce that and the recommended punishment.
Chris, would you like to take this? right now?
Sure. So the governor's executive orders do carry the force of law, and in state statute, they're allowed actually to be treated as an unclassified misdemeanor. We've opted not to pursue, at least initially, the criminal side of it, though. We're going to utilize the civil procedure, which also they're allowed to do. The governor's issued in his executive orders that we can treat these as public health violations. So the idea is that handling them civilly, an offender, I guess, for lack of a better word, somebody who is violating, whether it's requiring employees to wear masks or gatherings that exceed the stated limits, they'll be issued a summons and a complaint. They'll answer to a hearing officer that's appointed by the Board of Health, who then at that point will issue findings of fact. They'll take testimony, hear from witnesses, review evidence. At that point, he'll issue a findings of fact and a proposed fine. Really, that's the extent of it, fine.
As prescribed in the governor's executive order?
Yeah.
Will the accused be afforded representation?
No, it's civil. And there's no incarceration, it's just a fine.
Just a financial burden? And
Correct. So, and then after the hearing officer issues that, then it has to go to the Board of Health, which either adopts it or modifies it. They have the ability to, really change the fine or disagree with the findings of fact if they so choose. So that's kind of the process.
Okay, Mr. Foley?
Yeah, so my question is about enforcement too. So when will we start to see more enforcement happening of, like you mentioned, repeat offenders, for instance?
I think you may see that this week.
Okay, Legislator Nightingale?
Thank you, Kathleen, and thank you to you and all of your staff who have been working for 5 months now. As Chris said, burning both ends of the candle. I am wondering where your department is at with PPE supplies.
We're okay at the moment. We were able to get some of the suits we wear for specimen collection. We right now have a supply of N95 masks in the most commonly used size, but there is a smaller size that some of our staff wear that is a challenge for us to get hold of. And right now, we're a little bit challenged with extra large size gloves. And we'll use those not just for COVID clinic, but we use them for immunization clinic. So our purchasing representatives and our purchasing agency, like Don Carr and our staff in-house, are looking at all of our opportunities to try and find those sizes.
Okay, we'll go back to Petrus and then Mr. Didio, if you have a question.
Oh, thank you.
Yep.
I guess just to follow up, you know what? I won't take up time. I can check with the county attorney regarding the ability to call witnesses in order for the accused to defend themselves. But thank you.
Mr. Didio, did you have something?
Did you have a question?
Oh, okay.
Nancy, did you want to use the podium? Good evening.
Good evening. In March or April, an article entitled "That Discomfort You're Feeling is Grief" was printed in the Harvard Business Review. I shared it with colleagues as I thought it conveyed and labeled the feeling felt universally throughout this community, state nation, and world. All of us are feeling a number of different griefs. Loss of a loved one, loss of job, loss of money, loss of life experience, school, travel, playing a sport, family celebration, loss of known and successful business models, loss of safety, and grief when imagining our futures. I intend to briefly share examples of our daily interactions with our community members in relation to this COVID. But first, I ask that all of you do a check-in with yourself to determine what stage of grief you are currently experiencing. There's no right or wrong. It's individual and it's personal. We will fluctuate between stages, and there's no right pattern or way to move through these stages. Denial is one of the stages where we're avoiding, we're confused, we're shocked, or we're fearful. Stage of anger. We're frustrated, we're irritated, we are anxious. Bargaining. We seeking a perceived sense of control over something that feels out of control. We might decide we want some normalcy, and we will overlook what we're confronted with. Depression, overwhelmed, helplessness, and hostility. And we will finally reach that we will accept and we will explore our various options. And even further, we will seek meaning in all of this. Since March, we have followed over 700 persons, either as a contact or positive case. Within the last several weeks, there's been 400 plus precautionary travel quarantines that has come into this county. The precautionaries, we have worked with the state and they are managing it through their system. Some examples of I just got a little taste to give you of the encounters we've had. A Syracuse healthcare professional, a resident of Cayuga County, symptomatic and tested positive. Investigation and contact tracing was initiated. Healthcare professional denied having any contact other than with immediate family. This person used PPE in the work environment. We followed up with the employer, and there were no further contacts following our investigation within the work environment. Within 24 hours after doing that investigation, several of the indexes, and that's the person that was positive, friends called the health department to inform us that they had been in contact with this individual. It was on a beautiful day, the first weekend of May. It was a beautiful day after weekends of not so good in April. This healthcare professional had met up with several friends at different locations. This case involved 16 people over a period of 7 weeks. 3 family members became positive, 2 friends, including a recent cancer survivor. A family member's colleague at a large regional business became positive. To provide the required follow-up, it was necessary to request assistance of police and county attorney, as the healthcare professional did not want a health department involvement. Example 2. Elderly woman lives with family and provided care by this family and extended family. Very little exposure to community, very limited outside of that home, but limited. Becomes symptomatic, has significant underlying health problems, and tests positive for COVID. Family members want to be tested as they suspected one of the family members exposed their loved one to COVID. We established a family clinic and tested over 10 persons within the family. All the results on those family members came back negative. Visiting and caregiving of this elderly woman was restricted, not allowing some of those family members to visit. Third example, 27-year-old male, court ordered to drug treatment in Schenectady. We are informed on a day from this drug rehab that this person has left and had tested positive because they had an outbreak at the rehab. Police were involved in trying to find this individual, and the person was found in Cuga County at the family home. A colleague and myself, we followed this person because he was on methadone treatment for the drug abuse. Under this COVID, the governor lifted some of the requirements and allowed Oswego drug, I'll call them a drug firm, that are allowed to give the daily doses where the individuals have to go every day to get their daily doses. And that's prohibited, of course, for a positive COVID patient. So they allowed us to have the drug, and we dispensed the drug every day. That enabled us to keep him contained in a spot because we had the drug, and to keep his family that was now under quarantine. His speech was garbled. There was a day that I was there, it was late March, and you know what it looks like outside. And I had gone to a place I'd never been. And speech was garbled and he barely walking to and from the house. I put it in the mailbox. I needed to watch him take it. And I thought to myself, I bet as a young boy, he was a nice little boy, what a state that was in for him. He called about, I'd say 4 weeks ago. I'm kind of losing track of weeks. But we actually had to give him and his family a shared phone, so we make 2 contacts a day. We go to visit, but we also have a conversation with all persons, contacts, and positives each day, and they didn't have phone access. So we gave him the phone. He calls about 5 weeks ago, tells me who he is, and says he's out of minutes and he needs to do his therapy with that phone. I could not believe how concise he was. I couldn't believe that was the young man that had talked to me weeks before, how much improvement there had been. So that was a learning experience for me. Healthcare, another example. Healthcare professional tests positive following routine testing at her relatively new job at a Syracuse workplace. She was asymptomatic, no health insurance, lives with 2 sons without driver's license. The health department needed to provide food and cleaning supplies during her isolation period because she didn't have money or ability to get things. We did that. Upon reflecting on the stages of grief, as I described earlier, we can surely suspect varying stages of grief was experienced by all those individuals and their families, friends, and colleagues that I described. Every conversation we have, every conversation throughout every day, there is expressed grief, universal grief. During my career, I believe I've seen much grief, but I have never experienced universal grief that is affecting all. At the health department, our approach must be unwavering during this crisis. It is a new virus, new testing, new treatments, new regulation and guidance. We must be agile and receptive to assuming and accepting of new information and science related to this. We have to remain accessible 24/7. A person will just identify for themselves what is their crisis, and they need to have access to us to help them. We must show compassion, and more compassion. We must provide emotional support and patience. We provide current information, guidance, and direction. We collaborate with them in problem solving. If you can imagine these businesses that have been successful, whether it be a farm, a sales place, they've had successful models and now they have to change it. And we've tried to help them think and problem solve for their benefit. We serve as role models. They are watching they have their eyes on you, they have their eyes on us, and we must rise to that. It's important to keep in mind healthcare workers, police, and firefighters, and our leaders are experiencing this universal grief and are in one stage or another of the grieving process. These professions and others are socialized, normally always socialized, to set aside our own grief and rise to meet the needs of others. And this is our continued challenge. And one final note, there was a golfer that we had in quarantine. Quarantine is for those that have been in contact of a positive. Isolation are those persons that are positive. The golfer did share with me that he was going to blame his golf game on me and the health department. And I told him that was fair enough, and he could get 2 weeks out of that, is what I suggested. So we do see a sense of humor among us as well. Thank you.
Thank you, Nancy.
Questions?
Thank you. I want to thank the Health Department for your continued effort, unwavering compassion. I know I have received a few compliments myself of people who have been in contact with you, and the way that you have received them and helped them. They've been very complimentary, so I thank you both for your effort. Any other questions or comments? Mr. Lattimore?
You just complimented the health department. The funding side of, is the state coming through? How are we doing with resources with our money?
So I can speak to what's happening within the health department, that through our public health emergency preparedness grant, we can use that funding for COVID response and for overtime costs. So that's where we're putting most of our overtime. There are some other options that are related to COVID work that we are maximizing as well. And 36% reimbursement for this effort that doesn't get covered by that through state aid, assuming we get all that state aid.
Thank you.
Mr. Kerr?
I just wanted to echo your comments. I've talked to individuals that you've helped directly, and very appreciative of the work of the health department and the navigation day to day. For somebody that's been positively testing positive or impacted by COVID health issues, you've done a great job. Thank you.
Okay, at this point, we don't have privilege of the floor, really. Or do you have anyone calling in?
Somebody could use the same number, I suppose.
Okay. I'll announce I'm going to move privilege of the floor on the agenda. So if you would like to speak and have privilege of the floor at this meeting today, you can call in to 315-294-8051. Again, that's 315-294-8051. I'm going to allow the public to be heard again. We're going to say after CCC report, in case people would like to prepare to call ahead. Is that okay, Sheila?
Minutes to approve, June 23rd, 2020.
Move. Second.
Appointments and reappointments. Water and Sewer Authority, Andrew Rhineflesh, 1259 Great Gully Road, Union Springs, term 1/1/20 to 12/31/22.
Move it.
Second.
All in favor?
Aye.
And there are no communications or announcements.
Okay, do we have Dr. Durant on this evening?
Yes, good evening, everyone. Can you hear me?
Yes.
Great. Well, good to be with you. Just a few brief updates from the college. We, we're in the last month of our fiscal year, or about to begin our last month of our fiscal year, and we're on pace for a balanced budget. Even though we've, certainly been dealing with and reeling with all of the uncertainties, we have been able to make adjustments to our spending, and our revenues are as anticipated, and we're on pace for a balanced budget. We actually, as I reported last month, although it was early in our summer session, we have met and exceeded our enrollment goals for the 2019-20 year, even though year over year it represents being down in enrollment, which is never obviously our hope. What it does mean is that we're doing a decent job year over year of being realistic and predicting and how we're creating our budget modeling. And so that's resulting in us having some ultimate stability in our finances, which is, some benefit or relief during these times. We announced over the last month, and I believe it was around the time of the last ledge meeting or just after, that we are looking to reopen in the fall and reemerge on campus for our students. However, given the requirements and given the the financial realities and uncertainties, we have made the decision to put approximately only 15 to 20% of what we typically offer at our brick and mortar campuses in those spaces, representing a bunch of different modalities of delivery. And we just feel as though that was the right step for us to take at this time, so students would have some certainty in the choices that they were making for their class schedules, and whether it be a fully online schedule, whether it be a hybrid course or a full face-to-face course, that students would be able to sign up for things in advance and to minimize the other uncertainties that may happen during a particular semester. So we have brought some staff back to our campus, 12-month staff back to our campuses, and and we're following a screening procedure and really trying to become ready to allow students to come back in about 2 weeks, and we'll be looking to make a formal announcement for that in the coming days when it comes to some services on our campuses. In addition to that, we made the announcement with many other colleagues across the system in the country to suspend all athletic programs for the fall semester. And that was not a decision that we took lightly, but ultimately is one that I and the trustees felt as though was the right decision at this time. And our understanding is that the NJCAA, which is the national affiliation that we compete under, is going to look at some alternatives for spring programming, and we'll stand ready to look for some fall athletic teams to potentially compete in the spring, if that presents itself, depending on where we're at that particular time. And so from an institutional perspective, we are primarily focused on our reopening, the compliance. I have to echo the sentiments of the meeting to thank the health department and other leadership and their guidance, support, and education of us. We're doing the best that we can, and we'll continue to be as responsive and proactive as possible at our institution. And we're moving through as well as we can. Tonight in front of you, you have 2 resolutions, I believe, that are important to us as an institution. I'm going to ask for your support. One is our standard operating budget. That operating budget represents a 4% cut year over year, and represents what we think is a conservative assumption that enrollment will be down this year again, given the uncertainties of and related to higher education enrollment and so on and so forth. And we believe that it's a responsible budget from our trustees and from the institution. And what it includes, that's I think as most important for you all as the legislature, is given the uncertainties from the state and state aid and other factors. This year, I am not asking the county of Cayuga, our sponsor, for an increase in base funding and county support. We are just asking for maintenance of effort, and we're working through our other revenue assumptions, and we've balanced our budget accordingly and as necessary. The other resolution in front of you tonight is related to a successor agreement with our faculty association. Working diligently with our faculty association. Their contract was set to expire at the end of August next month, and we had reached a tentative agreement. It's a 3-year agreement. That agreement is one that we're going to ask for your support in as well. I want to thank and recognize the leadership of the Faculty Association for their openness, our discussion, and ultimately, coming to a point of, agreement prior to a contract expiring. It provides us with a great opportunity to have some certainty in our planning and ultimately to, be focused on our work and supporting our students when we can have, our labor contracts, settled and active. So I'd be happy to answer any questions, and I certainly would appreciate your support for each of those resolutions when they come up.
Okay, questions for Dr. Durant? Legislator Lattimore?
Dr. Grant, the COVID has created a lot of problems for everybody, but I know you put in some money for baseball, soccer, lacrosse, and culinary. Is the culinary going to continue even though the sports programs canceled?
Absolutely. The culinary program with the construction was halted during one of the moments of the governor's pause initiatives when it came to essential construction. Our project was put on pause, and it will be resuming. So the timeline has been adjusted. That is a DRI project. We already have an executed lease for that particular project, and have now for well over a year plus, and that project will continue once the project gets back up and going in construction. We're hoping for an opening for our spring 21 semester of that facility if all things go well, and we expect it to. And we have been finalizing and exploring a temporary site in our community to be able to allow all of our current students who are looking at enrolling in culinary this fall so that they can begin the cohort this fall.
Yeah.
As for athletics, we have, this investment in athletics, the shared service opportunity between us and the city and through the state program, this vision for athletics and modernizing Falcon Park to support our athletes is one that is an important strategy for us. And certainly with the pandemic that comes to have to halt our programs, it obviously is disheartening and frustrating, mostly because student athletes who may be in their second year and wanting to compete and intercollegiately are now going to be delayed, just like many high school seniors who didn't get a chance to play their spring sports. Certainly in the world of health and safety, there are more important priorities, but these experiences and memories are ones that are important. And we're looking forward to be able to safely be able to get our students up and competing and giving them those experiences that they so much deserve.
Could you give me an update on the Fulton manufacturing project?
The Fulton manufacturing project, we in the enacted budget, we did get approval from the state to match it. However, based on current financial realities of the state, it is our understanding that project and other capital projects that are being matched by the state are being reviewed and may have to now be held off for a period of time. So similarly to other government entities like your own that are waiting for what cuts may or may not be and what may or may not happen, We want to look for some specific updates, and once we do, we'll be readjusting our timeline or our approach. But at this point, that project was ready to be shovel ready this summer, and due to potential loss of funding at the state level, it may have to be readjusted, and we will be able to deal with that and outline a new timeline as soon as we have the information for certain.
In our platform with Nassau, you don't feel you can improve that with everything that's going on with the president doing the Space Force and just launched SpaceX? You don't think there's an opportunity there?
At this point, the college is really focused on its college programming to get everything that we have in place moving through. And when it looks for the other new programming that may or may not exist, we have to wait till our fall and get reopening before we can look at other new programs. We've been very fortunate in recent years to have a number of initiatives and expansion, all while building our reserves, fund balance, and stability. And we are, just like everyone else, weathering this particular difficult situation. And at this point, we think the responsibility thing to do is to deliver on the things that we know are important to us, get them up and going, see what the world looks like over the next 6 to 10 months. And with our trustee leadership, we'll be making decisions and plotting ahead formally after that, including a new strategic plan for the college.
The funding that's going to be in this last COVID is a once-in-a-lifetime opportunity, and have you looked at it and seen any opportunity there for our students?
We are looking at all the different COVID opportunities, and we are advocating with our elected officials for various fundings and supports. And in a lot of good ways, the first round of funding, a great deal of it went directly to students. And, we're looking for ways for the institution to, provide some of the relief that we have and some of our expenditures that have risen. But, certainly as other stimulus packages come up, if they do, we'll be looking at ways to maximize those resources to best position us for our future.
Legislator Kerr.
Hi, Dr. Durant. This is
Hello.
Kerr. I saw in one of your reports a mention of collaborative funding application with some of the other counties for short-term training programs.
Yes.
Can you comment a little bit about some of the stuff that you guys are working on as a college around workforce development for Cuba County?
Yeah, so this particular grant is one that is an opportunity that we may be partnering with other institutions to maximize the strength of the particular grant application. For us, and much of our workforce development work recently, we have explored the opportunity to bring in an apprenticeship program. That those credentialing areas is one that takes some time and some due diligence to be able to get through. That is one that we are looking at. Obviously, one of our visionings that also may be impacted by funding at this point from the state is the investment in the Workforce Development Center through Cornell Cooperative Extension gift. And so through those initiatives, we really want to be focused on sort of the tenets and the sentiments of our community when it comes to workforce development. One of the things that we did, for example, we secured a grant a couple of years ago from the state to investigate agriculture and to understand, such the lead engine of our community in agriculture, where there are ways for us to become more supportive and aware. We created an advisory group. We started to gather some information, and we're starting to develop a report from there of ways that we can get impacted. We've done similar things in manufacturing, both in Oswego County and partly here in, Cayuga County. And so trying to bring up the various sectors, economic development is another one. We're trying to come up with the various sectors to do an assessment of where gaps and opportunities may be. We have a long history of getting workforce development money from SUNY and partnering with local businesses to provide certain training for them. We know healthcare. We know that there's opportunities in human services. We know there's opportunities in the trades. And we're going to start to refocus our attention on where the gaps may be, who we can partner with, and then how we can be part of the aspirational vision of our global community. And that is going to be one of the core tenets of our next strategic plan.
That's exciting. Thank you.
Thank you.
Any other questions for Dr. Durant tonight? I don't see any online. Thank you, Dr. Durant, for joining us.
Before we go, Madam Chair,
Yes,
Madam Chair, this is Batman. Before we go,
yes.
yeah, I just want to say that I, and I'm sure the entire legislature, appreciates the work that was done that allowed the college to hold their request of us for a contribution at last year's levels. It's so important as we struggle with our budget. So thank you. Thank you, Dr. Grant. Thank you, Board of Trustees. Thank you, staff and faculty.
We appreciate that. We recognize that we're all in it together, and we're all going to go together the best we can, and we just felt like it was the right thing to do to help the county as well.
Great. Thank you very much.
Thank you.
Okay, next we have committee reports and individual legislator reports. Before we get to the chairman report, we're going to circle back to privilege of the floor. If anyone had called in at this point, no. Okay, so we don't have any calls. Is that right? No. Okay. You should let me know if you just, we'll go back to it. Okay. For the chair report, I will rush this along. Is anyone calling? No. Okay. I'll get through this. I just want to update you on everything that's been going on the past few weeks. It's been pretty busy here, but a lot of things have been going on. In response to Governor Cuomo's executive order, the New York State Police Reform and Reinvention Collaborative, which requires local police agencies to develop a plan that reinvents and modernizes police strategies and programs in their community based on community input. I've had a preliminary meeting with Sheriff Skank and Under Sheriff Smith. I will continue to work under the outline of this executive order, which requires a high level of collaboration with the city, the community at large, as well as local leaders from towns and villages. This initiative will span several months, and I will provide updates. But in this executive order, I will be the lead chair on this initiative. So I look forward to my work with the sheriff, police agencies, all of you, and the local community. I'm in the process of populating two committees. The Cultural Competency Committee. This committee will drive additional training and workshop recommendations for county leadership as well as county employees. The goal is to go beyond building awareness and sensitivity of cultural differences. Rather, what I intend to do is to initiate a process of learning to develop skills and engage effectively in cross-cultural situations. And then I want to continually reevaluate our skills over time. So I don't see this as a one-shot committee. I see this as a long-term committee. And so I'm going to, I've received some input from people who want to serve on the committee. Please continue to send in your interest if you'd like to join us. The second committee is the Cayuga County Ethics Committee. We're going to be examining the makeup of this committee closely, as well as reviewing the accompanying policies. So this is also beginning to populate. If you have interest, please reach out. I would like to thank DSS and the IT department for working with me in order to free up some space in the basement of the county office building. We plan a bit of an expansion of the Office of the Aging. They're currently operating in close quarters, and in response to COVID, additional space is necessary to serve clients when they are open for appointments. I'm also working on making the back door accessible for senior citizens, accessing OFA, in addition to providing help to any employees with mobility issues. I recently met with the DOT Regional Operations Commissioner for Regions 2, 3, and 7, Sean Hennessy. I met with Region 3 Director David Smith, Engineer and Local Point Person Chris Colbert, and Region 3 Director of Operations John Sexton. We discussed our partnership with the DOT. I've spoken with Tucker Whitman, the Oversight Chair of Public Works, and he will lead the snow and ice contract discussion in committee this month. Our furlough period will be coming to an end this week. We will be welcoming employees back and continuing to monitor and adjust to employee needs as COVID continues to be present in this community. Upon completion of the county COVID safety plan for departments on July 15th, we began screening employees across all departments with a questionnaire and temperature checks. I would like to thank Lisa Lippold from HR and her staff. Thank you, Lisa. Amy Russett and Harry Sherman from Emergency Management Office. They also made space available to us for the screening. Our employees have adjusted to this new procedure, and I commend them on their patience and compliance. I was able to participate in the first few days of the morning screenings. It was so nice to interact with the employees and help them navigate this new process. Although the process has gone well, we are streamlining the questionnaire so it can be accessed and answered electronically. I'm also investigating health screeners to take temperatures. This would allow for an even smoother process, so I'll update you on those advances. As the county representative in the regional control group, I continue to advocate for this county and our region daily. After 4 weeks at phase 4, we are impatiently awaiting information about gyms, hospitality, bowling, and other entertainment venues, to name a few. We have effective and at times spirited discussions with our control group leaders from Albany, and that work continues. We're also awaiting information about schools. The decision on how our children will be educated and interact in schools will be very important to the health and safety of our community. Parallel to that concern is the impact on the workforce in this county. The next few months will be pivotal to understanding how living life with the threat of COVID has changed our institutions, such as education. As an employer, this county and its departments are allowing flexibility where possible to provide accommodations to employees as required. Related to the Central New York Regional Group, COVID mandates of wearing masks and social distancing enforcement and its processes are being decided, as Kathleen had touched on before. I've participated in discussions in the county and state around enforcement. We've also been working with Ag and Markets and the State Liquor Authority. The County Health Department, the Sheriff, Auburn Police Department field many calls and complaints about neighbors and businesses, so, as well as I do also, probably as well as you do, as some of you have reached out. Documenting and streamlining the life of a complaint will enable our County Health Department to effectively educate and enforce mandates in an organized way so the community can anticipate consequences if it comes to that. So thank you again for your update today. Let's see what else. The State of the County is going to be on August 6th. It's going to be virtual. It's streamlined. It's hosted by the Cayuga County Chamber of Commerce, and it's 9 to 10 a.m. So I'm working with department heads on that presentation. So I'm looking forward to that day and sharing the state of our county with the public. Please check your email. We'll be discussing advertising for a highway superintendent. We will be discussing a salary range for that. We've had some feedback in our first process of our first review of candidates that did not yield a successful candidate. So we need to make a decision and move forward in that initiative so we can fill that position. I will ask this county to please practice hand hygiene, continue to wear your masks, social distance, and avoid crowds. Our infection rate, which is our probability of or risk of infection, is carefully monitored. Keeping the number low is the key to limiting the spread and further reopening of our economy. Please be mindful of yourselves and everyone around you to keep yourselves healthy. I also just want to thank everyone here for your support and your continued communication. I feel partnership is the only way to be productive, and I appreciate your participation and camaraderie during this time. Have questions for me? Mr. Lattimore?
Yes, with the furlough employees come back, I asked in health, we do have all the systems in place to keep our employees safe. And I think this is the first time in the country's history where the unemployed made more money than the employed with all the different giveaways. And I mean, we're talking about public safety. This is what created this layoff, world pandemic, all the different strains. But the watershed rules and regs are coming forward. I made 45 recommendations to that board. I have not heard back from anybody in regards to my recommendations. Water quality, pandemics and flu are important. Water is essential to be on this planet, and I think we haven't had any outbreaks, maybe one or two on the lake. It's been a wonderful season, hot, and it's rainfall has been down, so I think it's quieted the lake down, but we're anticipating putting in a major project at Wells College to have a backup secondary water supply, which I think has always been necessary for the counties. But
Yeah, that will be voted on today. Excuse me. The watershed rules and regs, we have not met as a group, but I believe we're in the state where they're being shared with the city at this point. I think that's where we've left it. I just received a message from Steve Lynch, I think yesterday or today about that, but you probably have an
The
update.
timing's impeccable,
Yeah.
Mr. Lattimore. So as you can imagine, things went on pause. We're pushing forward the watershed rules and regulations when COVID emerged. But as we are all adjusting, we know that our essential work must continue and has been continuing, and that is one of the areas that I think you'll see more of. Steve Lynch actually shared some emails in the last week and a half, so I think you'll hear a little more soon.
well, water quality is important as wellness with this pandemic. So.
Sure is, yes. And we have an important vote today related to that. Any other questions? I'm looking online also. Mr. Batman?
Yeah, I just want to point out that the Mr. Lattimore's statement about the voting on a water issue for Wells College is absolutely confusing and misleading. That is not the vote. We are voting today on a regional water district plan, and it's important to make that distinction, I think. So that I just wanted to clarify that. Thank you.
Okay, thank you, Mr. Batman.
Thank you for that clarification, Fussy.
Any other questions? Okay. Okay, we're going to get right to resolutions. Ways and Means, Mr. Petrus.
Thank you, Madam Chair. Ways and Means has 3 resolutions. WM2, I believe we have to wait for the public hearing to be closed.
Thank you.
So you want to
Actually,
circle back to that one?
I will, yes, we'll circle back to it right
Okay.
after this.
So I'll take them one at a time since there's only 2 at this point. So WM1 is appointing Kelly King as the director of the Cayuga County Employment Training Department. I'll move that.
Okay, any discussion on this?
I just want to say I'm really excited that we're filling this position. I think it's really needed in this community, and Holly's a great choice. She's been there for a long time. She has great partnerships with the regional.
Forgive me, this is Batman. It seems like someone's speaking, but I really can't hear. Is someone speaking?
Legislator Kerr is speaking.
This is Legislator Kerr. I just
That's
wanted
better. Thank you.
to make a statement that I'm excited that we're filling this position. I think there's a real need in the community right now, and Ms. King is a great choice. She's been at the department for a long time, and she understands the resources and the DSS connection that's going to be important for this person.
Other points of discussion? Okay, all in favor?
Aye.
Aye.
Opposed? Carried, thank you. At this point, it's 7:20, so I'm going to close the public hearing. Okay, Mr. Petrus?
Okay, so.
I will move Ways and Means 2 and 3 as a bundle. This is Batman.
Move it, second.
You want my job too, or?
Is he supposed to?
Well, that's fine. Anybody can move it, I guess.
How would
Okay,
you have two separated?
okay, we'd like to have two separated, so
Then I would move Ways and Means 2. Batman.
So, moved by Petrus, seconded by Batman. How's that? Adopt a local law authorizing purchase and service contracts to be awarded on the basis of best value pursuant to New York's municipal law and finance law. Can I get a discussion on this?
Yes. When we passed these laws, I mean, the governor passed a law, scaffold law, which cost every major project in the state of New York additional millions of dollars in cost. I just hope that this does not add to any cost. I've heard from different contractors that it does, but hopefully this will give us some control over local purchases and better bids. Hopefully this will look in our favor.
Any other discussion on this? Hearing none, all in favor?
Aye.
Opposed? Carried, thank you.
Just wondering if Chairman Batman wants to move WM3 or if I should.
Yeah. No, that's fine, Chris. I
Appreciate that, thank you. WM3 is fixing the day and notice of public hearing on a local law providing for salary increases for certain county officers elected for a fixed term during this term, and I would move that.
Second.
Any discussion? Hearing none, all in favor?
Aye.
Opposed?
Aye.
One opposition. Carried, thank you. Okay, Legislator Daily, Health and Human.
Yes, Health and Human Services had 7 resolutions this month. HH3 was tabled. The remaining went through both committees, Health and Human Services, and thanks to Mr. Ripley, Ways and Means. So unless anyone wants them separated, I'd entertain a motion to bundle HH 1, 2, 4, 5, 6, and 7.
Move it. Second.
Okay, any discussion?
Aye.
All in favor?
Aye.
Opposed? Carried. Thank you, Legislator Daly. Okay, we have Mr. Foley, Government Ops.
Madam Chair, Government Operations has 2 resolutions. I'll offer them up as a bundle unless anyone wants to vote out.
Second.
Okay, discussion on these. Mr. Durant did a nice outline for us. Okay, all in favor? Aye. Opposed?
Oh,
Opposed, Mr. Lemon? And Mr. Didio.
I'm
Carried,
sorry,
thank
forgive me. This Batman, who were the opposition to this?
Mr. Lattimore and Mr. Didio?
Thank you.
Okay, Mr. Batman, planning, unless Mr. Peters wants to take it.
Mr. Petrus, would you like to present this?
It's very tempting, Chairman Batman, but please proceed.
Thank you so much. So we only have one resolution, and that is authorizing the award, the final bid and the final execution of contracts for the construction at the Wasco Flats restoration, the part of a long project. So I would move this be approved. Thank you.
Second. Discussion. Mr. Lattimore.
I'm all in favor of this project to protect the lake. And since it took so long for this particular project to get done, years, I see Bruce just entered the room, years and years, and I think there's other streams and rivers that could use this kind of marsh and retention to keep the lake and keep the nutrients out of the lake. So I'd like to see us plan to put ponds on Vanessens and some of the other streams.
I too am very excited. Perhaps no one here is as excited as Mr. Natalie to see this go through today. I said no one here is as excited as you are to see this.
Can't understand you muffled with that.
I know. I'm trying to keep safe. I'm trying to yell.
Yeah,
We're off the rails.
Any other discussion? All in favor?
Aye.
Aye. Opposed? Carried. Thank you very much. Okay, Public Works, Mr. Whitman.
Madam Chair, Public Works has 7 resolutions tonight. I would like to move 1, 2, 3, 4, and 5 as a bundle unless anyone would like one of those singled out.
Okay.
Second.
And discussion on 1 through 5. All in favor?
Aye.
Opposed? Carried. Thank you.
PW6 authorizing the appropriation of $82,000 from the Economic Development Reserve to the Cuga County Water and Sewer Authority for the purpose of creating a central water district. This is a 2/3 required.
Move it. Second.
Okay, we're going to move in a second. Any discussion on PW6? Mr. Petras.
Yeah, thank you, Madam Chair. I just wanted to echo Mr. Lattimore's statement that, and Mr. Batman, I think he expounded on this, that this is imperative for us to move forward. It's necessary in order to have a map plan in order to move forward with the comprehensive project. So I'm excited for this and look forward to it. Thank you.
Great. Okay, all in favor? Oh, I'm sorry, Mr. Foley.
No, I'm sorry, I just want to clarify for PW6, I support it, but supporting this specific resolution to appropriate the money in order for them to complete the study and to get us numbers that we can ultimately, review the project does not mean that we ultimately support the project in its entirety. And I want to just make sure it's clarified as we vote on it.
However, I will note this next step is imperative to complete the project as well.
Right.
So I'm happy that we're doing that. Okay.
We're going to send the bill.
Legislator Kerr?
I would just echo Legislator Foley's comments that I vote for this night is for this next phase of this project and move it forward. I'm excited to get there and see what the plan is and what the costs will be for the people of the district. And I think there's potential to drive growth and development in the southern part of our county. We have water infrastructure down there along with the fiber internet access. But I do think we also need to look at how this new system is going to connect in with the city's existing system, how costs are going to be shared across the whole thing. So I'm looking forward to seeing that plan as it develops.
Great. Other comments? Mr. Lattimore?
I concur with Mrs. Kerr that for economic development reasons, putting internet in, the whole structure of New York City is changing. People want elbow room. They're thinking about coming up in our part of the country. Hopefully we'll have the infrastructure to build homes and businesses and stuff in our county.
Okay, any other discussion? All in favor?
Aye.
Aye.
The roll call.
You don't have to validate.
Opposed? Okay, you have everyone here?
No.
Nobody opposed, you don't have to do it.
Did somebody vote no that I missed?
No.
Okay. Okay, Mr. Petcher.
I got one.
Oh,
I have
yeah.
one more.
I'm sorry, Mr. Whitman.
PW7 was a late ad, fixing day and notice of a public hearing on pursuant to New York General Municipal Law 6D to make appropriations from the Buildings Repair Reserve. I'm not sure if Gary's on. He could address this a little better than I as to what this is, or maybe even Mr. Palermo, but I'll go ahead and move PW7.
Okay, second discussion. Can you update us?
Gary, he can probably,
Because Gary can,
so the resolution is to set up.
I'm here. Gary Duckett is on.
Okay, Gary, can you update us on PW7?
Yes, what this is all about is the E911 administrator is a grant for $175,000 to replace the generator, the backup generator at the public safety building. It's got to be used by the end of the year. We went out to bid on this project through purchasing, and the low bidder was $337,196. So basically what we need to take out of the reserve fund is about $163,000, and we can replace the backup generator at the jail. If that thing was to fail and we needed power, we'd have a real problem. So I think everybody's pretty much in agreement that it would be a good idea to proactively replace it. And this is an opportunity to leverage the funds that Denise received in that grant.
And Gary, what was in that reserve fund again?
There's right around $900,000. How much? Right around 900,000.
Thank you.
Okay, and then this
You can only spend it once.
Mr. Whitman, I believe this will also be discussed at committee this month also.
Yes, it will.
Any other questions, comments, concerns? Okay, all in favor?
Aye.
Aye.
Aye. Opposed? Carried, thank you.
Thank you.
Mr. Petra. Judicial Public Safety.
Judicial and Public Safety has five resolutions. I'd like to bundle them all. Number 5 being pulled.
This is Batman. I'll move the bundle.
Any discussion? All in favor? Aye. Opposed? Carried, thank you very much. Okay, we have a few resolutions that are in front of you tonight that have been offered up by various legislators. I appreciate everyone taking on these initiatives that are in front of you. And I'm going to let the people who sponsored them speak about it. I'll let Mr. Latimer, would you like to talk to?
Madam Chair, could we have a motion and a second before we have discussion, please?
You sure can. Can we get a motion?
Can I have, before we motion and second a resolution, can we say what it is? Because I do not have it in front of me.
Okay, thank you. This is the resolution. It's support of AA and NA. Do you have those up?
They were sent.
Alcoholics Anonymous and Narcotics Anonymous. There it is. Okay. Can you see that now, Tucker?
Yes, thank you.
I'd just like to say that this does not cost us anything, and
Well, let's do a motion in a second.
okay.
Okay. So we're going to look to move this. Do you need more time, Mr. Whitman, or anyone else?
No, I'm good.
Okay. Can you get a motion?
I'll move it. Second.
Okay. Discussion. Go ahead, Mr. Latimer.
Legislator Kerr and I have got together along with mental health and Monica and who's doing some studies. The cost effectiveness of this proposal with the governor tightening up his budget. I know that our psychologists are charging about $230 an hour to have talk therapy and other mental issues relating to addiction. This AA and NA, little or no funding is necessary in order for kids and addicted people to get to meetings and actually straighten out their lives. So I appreciate Ms. Kerr and Monica and Ray for helping out with drafting this. And hopefully the governor can see the next time that we have a pandemic that this is not a social gathering, that it's absolutely mental and physical health. People die from addiction, and hopefully this will pass from our board, and we can shift that up to our elected officials and get the city of New York, like Rhode Island has done, to not shut down these necessary meetings.
Any other discussion? All in favor?
Aye.
Aye.
Carried. Thank you for your efforts, both Legislator Lattimore and Legislator Kerr on this. Okay, next, we're gonna do New York State funding judicial reform, criminal justice reform.
Move it.
Second.
Do you have that in front of you, Tucker?
I can see it on the screen. I'm good.
We have a motion and a second discussion. Mr. Petra, would you like to offer anything on this?
Oh, this is mine, okay, yes. It's a basic resolution opposing unfunded mandates, which has been passed by other communities or municipalities, so that's about it.
Thank you. Any further discussion on this?
Yes, Madam Chair.
Yes.
It's Ms. Batman. So I hit the wrong thing and disconnected, and so just reconnected. So if this has been said, please forgive me. But I suspect that everyone is in support of the ideas behind this resolution. But as what I did hear from Mr. Lattimore prior to I disconnected myself, pointing out that part of the point of this resolution is the next time there's a pandemic, we hope that the governor. What that suggests to me is that we can send this through committee. This is why we have committees. We have committees to discuss things, to ponder them, to work through all of the issues. And I suggest that we need to put this back through committee. It's not an emergency. We approve it now or in August, we're good. And so I move that we table this to the Health and Human Services Committee for consideration and for bringing forward.
I think we've moved on, Keith.
Oh, you have? Well, it's terrible when you disconnect. So it was approved?
Yes.
Okay, my bad. Sorry.
But this is noted. I mean, typically the resolutions that come before us should be emergency, as we should have ample time to digest and discuss.
Yes.
So that is, thank you.
For the future. For the future. Thank you.
Now we're on the criminal justice reform resolution. We've motioned and we are discussing it. I think we're through with discussion. All in favor?
Aye.
Aye.
Opposed? Carried. Thank you. Okay, our last resolution is sponsored by Legislator Kerr. It's the federal aid for COVID-19. Can I get a motion on this one?
Move it. Second.
Okay, discussion. Legislator Kerr, do you want to?
Yeah.
Highlights?
First of all, I just want to acknowledge that this came to everybody last minute. So I know that there hasn't been a lot of time to look at it. I do think there is an urgency here. This resolution relates to direct federal aid to local municipalities in the next stimulus package that is being negotiated right now. And given the projections of financial loss to the county right now, they are significant. Without this federal funding, we're likely to have significant state aid reductions and definitely more impact locally. So it's that's what I'm putting forth for consideration is to make a statement for our representatives to lobby for this direct aid to local municipalities and to support proposals that move that forward.
Thank you. This is crucial funding that we're looking for, crucial to the county. I know that folks I've been hearing from Senator Schumer's office contacts me regularly to update. They're pushing really hard. So we're just going to be, I guess, waiting this out to see what happens. Mr. Lattimore?
I go along with Trish on this. In regards to Mr. Batman's last statement about going through committees, I did take it to the Health Committee and other committees that I was on, so it did meet the test of committees.
That's true, yes.
And I appreciate his comments, but I'm in favor of Trish's amendment to the governor.
Any other discussion on federal aid for COVID-19, Ms. Nightingale?
I just wanted to say that I appreciate the work on this because I find the resolution to be very timely with our own budget discussions coming very soon. This is a good time to be moving such a resolution forward.
Absolutely, right. I agree. I don't see anyone else's hands up. Okay, all in favor?
Aye.
Aye. Opposed? Carried. Okay, any other business that can come before the board?
Motion to adjourn, Madam Chair.
Second.
Okay, all in favor?
Aye.
Carried, have a nice evening. Thank you very much for joining.